We'll begin with the age column. This has been consolidated with the gender column. The functionality is simply using color coding. Blue indicates male and pink indicates female. White would indicate gender unknown. Over on the PNED column, or PowerNote ED, there are three possible icons that can show up. It's very important to understand that these icons only appear for the individual who is currently signed on. Therefore, if you go to the grease board, you won't see any icons because the grease board does not carry the rights and permissions as a physician to start any documentation. So for you being signed on, what will you see? You may see any one or combination of three icons. The green icon indicates that I have been assigned to the patient and my note or notes have been signed. Notice that by hovering my mouse, I can get a pop-up to see the status of those notes, or the titles of the notes. Yellow would indicate that I am assigned to the patient, and my note is currently in progress. And then finally, red would indicate that I am assigned to the patient, but notice there is no pop-up. That means that there are no notes started on this patient. The order column simply indicates that there are orders requiring signature. Now that you've seen the enhancements to the tracking board, let's go over the process of how to launch PowerNote. Right-click on the gray box on the patient's line, just hover over patient chart, and then left-click on PNED. The next step would be to click on Add in the upper left-hand corner. Add opens up a new session for PowerNote in terms of being able to search for the PowerNote that you desire. Now we'll go into a little bit more detail and explain how to locate the PowerNote that you wish to use for your patient. Prior to doing so, it's important to point out that PowerNotes are not tied to diagnoses. PowerNotes are associated to symptomology. Therefore, we would suggest that you select in the multi-symptomatic patient that one symptom that causes you your most overarching concerns and or would cause the patient demise most quickly. You may also have more than one PowerNote per patient. There's nothing stopping you from doing that, but for the purposes of this tutorial, we want to keep it simple. Notice that for this patient that we're about to use, a 38-year-old male with a cough, we're going to go into our PowerNote module. Remember, a right-click, open patient chart, followed by PNED. Once there, we want to click on the button labeled Add. As we go into the PowerNote search module, we want to stress that there are certain things that do need to be filled out, such as the type field should contain ED Physician Doc. If it does not, activate the drop-down list and select ED Physician Doc. You will not need to do that again for any further patients or PowerNotes. Once you've done it, it sticks. The date and the time auto-populate, but the time that is appropriate for the starting of this PowerNote. The title field is to be left blank. Please do not put anything in here. If you were to click Existing, you would see the PowerNotes that have amassed on this patient for the current encounter or for all encounters. Now this is valuable for those patients that come back, say 3 days later after having been discharged from the ED. You would have immediate access to the PowerNote that was created on that patient at that time. So it's akin to getting old records. Going to the Pre-Completed tab, the Pre-Completed note is a template that has been saved based on your desired best practices for a specific symptom. So for example, for the fast-track patients, it is possible to go through your note, and as you complete it, you may look at that note and say, you know, I want to use that every time I get an ear pain that is most likely otitis media. So how does the Pre-Completed note work? Well, after you've done your first run-through on a patient with otitis media, with initial complaint of ear pain, you would simply go ahead and save that note as you've completed it as a pre-completed note to be used in the future. And then, when you have a repeat otitis media come in, who has the complaint of ear pain, you would be able to bring this pre-completed note in, and it will totally complete all the fields, giving you the opportunity, of course, to change those things that are customized or unique for the patient that you're currently seeing, such as maybe the pain is in the left ear instead of the right ear. Reason for Visit is the tab that you want to be on for initially selecting your PowerNote. You will notice that on the navigator, this is divided into systems, as well as other things such as administrative, direct admit, AMA discharge, and so on. So don't try to look here and find diagnoses. For example, our patient has cough. Please do not come in here looking for pneumonia, bronchitis, or otherwise. Instead, locate cough. Once you've found your symptom or your reason for visit, double-click, and it takes it over to the area labeled Reasons for Visit. For the multi-symptomatic patient, double-click the main title for that system, in this case gastrointestinal, and bring over the gastrointestinal PowerNote, which is a composite of all the symptoms that would be under gastrointestinal, giving you the opportunity to chart several symptoms under one. Once you have your reason for visit populated, click on OK. Upon doing so, this will launch another window, which is referred to as the auto-populate document. Remember, this patient has been triaged, and there is now data within the person's record for this encounter. Now, this is data that you can bring automatically into your PowerNote without having to transcribe it, let alone try to hunt it down. So let's take a look at this. On the auto-populate document window, we see that we can include vital signs that have been charted by the nursing team, as well as height and weight, O2 sat. We can bring in information from other systems, such as lab, as well as being able to bring in med profile and allergies directly into your PowerNote. Some of you may be thinking, you know what, I don't really want any of this brought in, and that's fine. It's only going to be brought in if there are check marks. And incidentally, if I indicate now that I want my vital signs from my flow sheet, as well as my height and weight, the O2 sat, my med profile, I also want to be able to record within my PowerNote the allergy information. Those check marks will do just that. That will import to my PowerNote, plus subsequent opening of the PowerNote module will have these selections that have stuck since these check marks have been put in. That is to say that I have now created some defaults, and these will always appear every time the auto-populate document window appears. If you don't want something, simply take it off. Clicking on the OK button will then launch the PowerNote itself, as well as auto-populate those items that were checked. Remember that we did want to bring in our nursing documentation that included the vital signs, the O2 sat. We also selected the medication profile and allergies. These are now into my PowerNote instantly. We'll begin the process of our documentation by explaining, first of all, how does one navigate through the PowerNote. You are currently looking at a PowerNote that is centric to the symptom of cough. The navigator on the left will jump me through the PowerNote in an area that I prefer to do my documentation first. For example, if it is an ear pain or a cough or something that is very benign, and you have literally jumped right to your physical examination, you may wish to start with the physical examination. Your workflow is supported by the navigator on this side. If you wanted to get more granular, one could click the plus sign, not the title, and be able to expand the tree and go straight for the respiratory on the physical examination portion. However, for this tutorial, we're going to keep it fairly basic. And having said that, we'll start with the basic information by clicking on this and indicating the time seen. Know that you can't change the time. And perhaps the patient came in with a family, and if you want, you can do a right click on any term that you have selected, and with the right click, it can invoke the comment field command and be able to place in any free text that you wish at this time. So in this case, I may wish to indicate that the wife came in and the wife's name is Evelyn. And that posts cleanly to my PowerNote. They were ambulatory, and we'll come down to the history of the present illness. It is a cough. The individual indicates this has been going on for about 3 days. And it is a episodic, it's coming and going, and this is a moderate cough, and the person really has no sputum at all. What did I do just here? This is a pertinent negative. They have no sputum. What you can do then is to select, then click one more time, which in this case puts a strike through on productive. This is how you would use the pertinent negative functionality. No exacerbating factors, no mitigating factors, no risks that have been identified. The PowerNote auto-scrolls to bring me the next set of lines. Documentation review, this will be very important for HIM. There was documentation, of course, by the ED nurse. I'm going to indicate that I reviewed that. There was no re-examination. And then finally, for my diagnosis, notice that the diagnoses are already automatically coded with ICD-9 codes. And at this point in time, all I need to do is indicate that this person now has a diagnosis of perhaps simply, who knows, viral infection. I'll leave it at that. You do have the option to diagnose code search. They're out the door at a certain time, and here we have to be careful because the top line where it says time, where you'll probably be very tempted to click on that right off the bat, is addressing the items on the top line, such as AMA, eloped, expired, and so on. Instead, go deliberately to the item labeled discharge, click on time. You can accept the default if that's the correct time, otherwise change it as needed. Patient went home. Again, you might want to do a right click, indicate by the comment, accompanied by. There is no restriction placed on activity. How would we do that? Remember the pertinent negative. Single click and click one more time, indicating that there are no limitations on activity. Follow up, well, just return to the ED as needed. You could also indicate primary care physician in 3 days. At this point, I have finished my PowerNote, and I can do a number of things. The most obvious would be that I would sign the note at this time. Let's assume for a moment, though, that I didn't get down to disposition, and for that reason I would want to save it. Perhaps I was right in the middle of documentation and I needed to go off to another patient very quickly. So I would simply click on Save and Close. You can also save the note at any time. If you're going in and out of the record incrementally adding information, simply click on Save to get that PowerNote to retain that information. The only time you want to sign the note is when you truly are finished with the record. A couple of housekeeping issues that you do need to know of. Once you do click on sign, you have essentially locked the record, and you cannot go in and change anything on the PowerNote itself. In which case, if you do have any additions, any edits, you would have to start an addendum.